Hello, this is Soleil, and this video is brought to you by Honestly It's, a circular beauty brand that produces upcycled, high-quality, innovative skincare that is perfectly good for your skin and good for our environment. Wait, why am I saying this? Actually, I work there, that's why I'm promoting it that much. Anyways, today's video is about BUTTNE. So what is BUTTNE? If you click on this video, that means you have it and you want to treat it or prevent. Most probably treat, because you probably already have it and it's already summer and we want to go out there to the world and show off some butt. Okay, I'm joking. Today's video is going to be about BUTTNE, how to treat it and prevent in 2 easy steps. If you of course follow, you'll see the results. So let's get started. But before we start, of course, do not forget to subscribe and probably like. And if you have any questions, you can always comment down below. Okay, let's get started. First of all, what is BUTTNE? BUTTNE comes from 2 words, buttock area and acne. Together, it's called BUTTNE. Actually, there is no connection between BUTTNE and acne. Acne is a different type of skin condition that is caused by the excess production of oils from sebaceous gland that come up, and then the bacteria mixes up and then they cause the inflammation, and then you see those whatever. And BUTTNE is completely different type of skin condition that includes 2 different types of skin conditions, and we're going to talk about them right now, because when there are 2 different types of BUTTNE, there will be 2 different types of treatment, and you should know about those so that you can treat, so that you do not cause extra problems to yourself. But we can also use these tips for chicken skin. Chicken skin is the same thing as BUTTNE that occurs at the back of your arms, the back of your thighs, and these areas have exactly same skin condition when it comes to BUTTNE, and they are Keratosis Pilaris and Folliculitis. Ooh, sounds interesting. So let's begin with the difference, how to differentiate, and how we can treat them. First of all, let's talk about Keratosis Pilaris because it's the most common one. Keratosis Pilaris is chronic condition, so you're basically born with it. If you have it, it can be genetical. So if someone in your family had Keratosis Pilaris, you have a 50% of chance having it. So how to differentiate Keratosis Pilaris from folliculitis on your skin? For Keratosis Pilaris, when you touch your skin, it's a little bit dry and not necessarily you feel the pain. You can have the itchiness, but the itchiness comes not from the bumps, but from the dry skin. On the other side, folliculitis is a skin condition that is caused by an inflammation. And the feelings and the touch of folliculitis is a bit different. However, they might look similar when you look. Folliculitis happens from an inflammation that is caused by some kind of irritation. It doesn't happen to everybody, but if you are male, you have a more chance of having folliculitis. So now let's talk about how these 2 conditions can happen. Since Keratosis Pilaris happens on a drier skin, the condition with drier skin is that it's harder for drier skin to shed it off. There's a skin cycle, which is around 2 weeks and more, where new cells regenerate and the old skin cells shed off. But when you have a dry skin, that means it's really hard for your skin to kind of shed off by itself. So what happens is that those dead skin cells pile up and they kind of block the hair follicles. The hair follicles get stuck with dry skin. That causes the bump that you can see. If you have allergies, that means your immune system is a little bit low, which causes your skin to be a bit weak and lose its own hydration system. The term for this is called transepidermal water loss. So basically your skin loses the water, which causes the dryness, and then we have Keratosis Pilaris. For folliculitis, I've already mentioned, it's an inflammation. Anybody can have it. So some reasons that you can have a folliculitis are: it's an inflammation caused by bacteria, fungi, viruses. Where you can get these? Hot tubs, sweating, dirty clothes, humid weather where you sweat a lot and then there is a lot of friction. That's when you have infection. That's when you have a folliculitis. The bumps, which are actually painful and itchy. Period. Another causes of folliculitis are shaving. If you are using steroids or antibiotics, especially topically, that can also cause folliculitis. And now we're going to talk about the steps, 2 easy steps that you can take to prevent and treat BUTTNE. For keratosis pilaris, which is dry, not painful bumps, the red bumps, you can use an exfoliator. You need to shut off that dead skin cells, right? When you can use exfoliators 2-3 times a week, depending on your skin sensitivity. So if your skin is very sensitive, which means like, you know, when you have something physical going on there, you're like, oh, I don't feel comfortable. That means you're kind of sensitive. So I would highly suggest at least once a week, you should properly exfoliate to get rid of the dead skin cells. Period. And since this video is brought to you by Honestly It's, we actually developed an amazing product that can exfoliate physically with upcycled coffee beans. It can cleanse the skin from all the dirt and oil because it has cleansing agents. And it is filled up with a lot of antioxidant rich oils and caffeine, which can help the skin to not lose its own its own moisture when you're taking shower. Because let's be honest, some soaps, some body washes are not that good when you take a shower, especially if you have sensitive dry skin. Your skin gets drier when you take a shower. And this product that has been developed and been developing for 9 months, has been testing for a long time, does 3-in-1 action: exfoliation, cleansing, and keeping that moisture in. So if you're interested in this product, the links will be down below. Another way of exfoliation is a loofah. Please make sure to use a loofah that is reusable and not made from plastic, because we want to keep our environment safe. Another way of exfoliation is a chemical exfoliation. I would definitely suggest using chemical exfoliators such as AHA, BHA, PHA, but you still need a physical exfoliator to kind of shed off the dead, dry skin cells, because chemical exfoliators usually go a bit deeper. They go into the pore and they kind of melt down whatever is in there. I would highly suggest to use a BHA toner. So any BHA toner, BHA is salicylic acid, can work perfectly. If you use it 2-3 times a week, even for sensitive skin, it can work. I've been using a 5% BHA toner on my chicken skin, and it actually helps. It's not that sensitive. However, you should know your skin type. I would suggest a toner because it's much convenient. You don't have to wash it off. AHA could be a bit stronger. You might not feel comfortable, but you can give it a try. Yeah. PHA is another type of chemical exfoliators, which is not that famous right now, but it's the best product ever for daily use. If you are that dedicated to use some kind of product on your skin every single day, then go ahead for PHA. It's the best. And if a body wash includes any kind of BHA, AHA, PHA, good. And the second step would be you need to moisturize, because your skin needs that water. Not directly water, but like hydration is important for dry skin, sensitive skin, allergic skin. Because the reason that you have this problem is because your skin is losing its own water. So you need to moisturize. And actually, if your moisturizer contains any of BHA, AHA, PHA, it's just perfect. You can use a loofah or a scrub, and then you can use a moisturizer that contains one of these AHA, BHA, PHAs. Highly recommend. So now moving on to folliculitis, the bumpy, itchy, painful ones. I will first of all suggest you to check your routine. Are you taking any steroids? Are you taking any antibiotics? Like you're taking them, you're applying them topically, just check in first. Then see if you're actually shaving the area that has the chicken skin. Maybe you should stop shaving. That could be the cause of your folliculitis. Second, maybe you're living in a hot climate, humid, hot climate that is causing you the sweat, which is causing you the irritation and inflammation, folliculitis. Check that out. Next, if you are wearing tight clothes, you should change that. For folliculitis, this is actually, it's not a step, it's a pre-step. So you should try checking what you are doing that is causing the irritation, which is causing an inflammation for your skin. You should stop it, see if the folliculitis is still happening. You should visit a doctor. As I said, it's extremely easy. You just need to understand what is causing the problem, and the solution is simple. 1 and 2, exfoliate, moisturize. That is all for this video. Make sure to subscribe, and if you have any questions, comment down below. You can find me at Honestly It's Instagram. I don't use much of my own Instagram because it's useless. Yeah, that's it. I hope you liked this video. See you next time. Bye.